Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about renal. So we have a 71-year-old male patient presented with 3 episodes of bloody diarrhea. The patient also gives history of urinary dribbling for the past 2 months. Remember, in someone who is old and is having urinary dribbling, it could be a BPH symptom, which is benign prostatic hyperplasia. Men greater than 50 are at increased risk for benign prostatic hyperplasia. So, and now the patient smoked a pack of cigarettes for the past 32 years. Remember, this is important in history. Always smoking is important because it's a clue for a lot of the disorder, a lot of diseases, especially cancers, for example. So now, vitally, the patient is stable. Digital rectal examination shows a symmetrically enlarged prostate with no nodules. So this is BPH, benign prostatic hyperplasia. Remember, if they say symmetrically enlarged or diffusely enlarged prostate with no nodules, they're talking about BPH. If they just say nodules, they are talking about, if they say it's not symmetrically enlarged, but they say DRE shows, rectal examination shows nodules, that they are talking about prostatic cancer. Alright, so now then they said urinalysis shows no white blood cells but high power field, which means no infection probably. So there is no infection going on. 3 red blood cells, so that is microscopic hematuria. No costs or dysmorphic red cells. Remember, costs will be seen in someone with glomerulonephritis. So if you have glomerulonephritis, you are going to see costs or dysmorphic red cells. Very important, because if you have the kidneys here, and we have the ureter here, and then we have the bladder, so if someone has costs here, the costs are coming from the from up in the glomeruli. So if you have something pathology here, you are not gonna see costs, no costs, if it's below the kidney level, because in the kidneys, that's where you see the costs. So this patient, now we know that it's not the kidney, right? It's not the glomeruli, it's not glomerulonephritis, because there are no costs. So we can look at the bladder. So now C-ANCA, wrong answer. Usually here for C-ANCA, they usually would look for something called the Wegener glomerulonephritis. You can call it Wegener glomerulonephritis for the C, to remember the C in the C-ANCA. And remember, you involve 3 things: the nose, and then the kidneys, and then the lungs. So these 3 are important. Nose, you can get like nasopharyngitis, and the kidney glomerulonephritis, and then the lung, you can get hemoptysis and stuff like that. It is a vasculitis. Here, wrong answer, because there are no costs, so that doesn't look like it's glomerulonephritis. Then prostate biopsy, wrong answer, because here they clearly said there are no nodules, so there is no need for biopsy. This is a typical BPH. So then cystoscopy is the right answer here. So remember, anyone with microscopic or gross hematuria, any male with microscopic gross hematuria and is old, you are especially, plus there is a history of smoking, you are going to do cystoscopy to look for bladder cancer. So you are going to do cystoscopy to look for it. So urodynamic study, wrong answer. This is done for different types of, in order to differentiate different types of incontinences. So if there is a mixed incontinence and you want to know which type is predominant, you can do urodynamic studies for that. So there are some risk factors for prostate, for the bladder cancer. Bladder cancer, remember, you can get it from, there was a mnemonic that was used for first aid, was the PSAC mnemonic. Phi was for phenacetin, but it is not existent now. Phenacetin not used anymore. Smoking, very important. For bores, smoking, very important. It's very important to know this. High yield. So now, and then we have the A is just for aniline or dyes. You know, the aniline dyes, aromatic dyes that are used. They're also risk factors. C is for cyclophosphamide. So these are some of the risk factors, the PSAC, that the boards want you to know. You can get it from exposures, occupational exposures as well, like in painters you can get it. You can also get it in, for example, metal workers. So hope this video was helpful. This is a very high yield question, very classic, and they can ask in any USMLE step exam. So if anyone is interested in tutoring, they can email me here. And if you like the channel, you like the content, you can support me here. Thank you for watching.